So what we're finding with Riley here is he's missing external rotation. What was the original injury?
Wasn't really like I don't know what happened. It just kind of happened one day, and then I just couldn't press up. I couldn't pull out.
It was just jammed.
It was just jammed. My trainer thought it was like kind of like my back was too tight.
Yeah.
This was too tight. So I did do the exercise you did against the wall.
Yeah.
And then I'd be laying on my stomach with the ball trying to loosen it, but then it never really helped for 2 weeks. But then over a month, it kind of slowly went away once I got here.
Mm-hmm.
But there wasn't it wasn't I never got hit, and then it happened. Just kind of woke up and happened one day.
Okay. So he's missing external rotation, but he's also missing horizontal abduction, so out to the side. And so a lot of times what will happen is you'll feel really tight in the front, and a physio, chiro, even an athletic therapist might give you just a classic wall stretch, but it's actually doing nothing because he's got no room to move his shoulder into the back. So we actually have to open up the back to improve this and make this stretch actually effective. So what I'm going to get you to do, Riley, is sit up and face that wall. So I can do this with exercise too, but we're just going to do first with manual therapy. So you're going to bring your arm out to the side, right arm. I'm going to pin that tissue, and then you're going to grab this elbow and pull it across your body. So reach across your body. Yeah, pull it right across. Good. And you're going to feel a little stretch there. Yeah. And then come all the way back. And we're going to repeat all the way down kind of that medial border of the scapula. Good. Keep going. Pretty tight in there. Yeah. And you just worked out too, so. Yeah. Good. Keep going. Good.
Does feel tight.
Yeah, so a lot of people, they think they're tight in the front, but they actually have no space to move that glenohumeral joint into the back. So keep going. Yeah. And I shouldn't have to do too much, so go out to the side just to give, and then same thing, now I'm working on that posterior shoulder capsule. Good, so I'm just pinning it in the shortened position, and then you're lengthening it. Good. Good. Pretty stiff in there too. Yeah. Okay. All right. Now you're going to lay back again with your shoulder right off the bed. Now we didn't get all this on camera, but it should be a lot easier than what it was. So as soon as this palm starts to rotate, that's when I end. So, but I can get you a little bit further, quite a bit further. Yep. And then scoot back to the middle. And then if I look at that shoulder rotation, way better, right? You were here before, and now I can just drop out because now that ball and socket has somewhere to kind of move. So now if you went and did that kind of classic chest stretch, it'd be a lot more effective because now you're not fighting that joint. Does that make sense? Yeah.